Good afternoon. On behalf of Pelham Medical Center and Spartanburg Healthcare System, I welcome everyone and thank you for joining us today. I'm Lindsay Lewis, the Manager of Community Outreach. Our speaker today is Stacey K. Williams. She serves as the Survivorship Program Manager at Gibbs Cancer Center. Stacey has been with Gibbs for 9 years, and in that time, she has used her public health background to develop and implement programs to meet the needs of survivors. In addition to the variety of health and wellness programs, the Survivorship Program offers a clinic for patients that have completed their cancer treatment. Stacey enjoys her work with cancer patients and looks forward to helping them achieve their health and wellness goals. If you have any questions for Stacey in the upcoming presentation, please type them in the Q&A box and I will ask them to her at the end of the presentation. And now it's time to begin our presentation titled Living Life After a Cancer Diagnosis. We're very pleased to have Stacey join us today for this presentation. Welcome, Stacey. I will now turn this presentation over to you.
Good afternoon and welcome to everyone. I'm so excited that you decided to share your lunch hour with me today. Today we will be talking about cancer survivorship and living life after a cancer diagnosis. As Lindsay said, I am the Survivorship Program Manager, and so I'm going to share some things with you today about cancer survivorship and how that may apply to you if you are a cancer survivor, and also to your loved ones who may be cancer survivors. So let's dive in. There is a lot of questions from individuals who are survivors, their caregivers, their family members about who is a cancer survivor and when do you actually become a survivor to carry that title of a survivor. Many times individuals may think that I have to complete my chemotherapy or I have to complete my radiation therapy or I have to have a certain type of scan before I am considered a survivor. But with this definition, you will find that in cancer, a person is considered to be a survivor from the time of diagnosis for the remainder of their life. So the day that you get that cancer survivor diagnosis, you are a survivor. So let's look at the cancer care continuum and how that applies to you as a survivor. So survivorship is a very new portion of the continuum. If you will see here, survivorship is at the very end. There used to be a time where it was just the etiology, which is the health behaviors, our genetic factors, our environmental factors, just the prevention, tobacco control and diet and physical activity, vaccinations and limiting alcohol use, sun protection, things of that nature. And then we move on to detection. And so detection is typically the area of the continuum that individuals are most familiar with. With detection, this can be having a pap smear or HPV testing done. This can include having your mammogram, having a colonoscopy. For men, it's having a PSA done, also having your fecal occult blood testing done. So that's the very familiar portion for people. And then if you are a survivor, the diagnosis phase of this care continuum is familiar as well. This is when the shared decision making takes place, when your physician will speak with you about your diagnosis and you will come together and make a decision about your plan of care going forward. And after the diagnosis phase, then we transition into treatment. And so treatment can be with a curative intent. It can also be with a non-curative intent. And it also includes symptom management. And so we're very familiar with this aspect of the care continuum as well. So the survivorship part of the continuum is somewhat very new. This probably started in the late 90s, the early 2000s, when we realized that our cancer patients are living longer and we need to be doing things a little bit differently to meet their specific needs. And so in survivorship, we discuss things such as coping and also healthy behavior promotion. So let's talk about some statistics as it relates to being a survivor and cancer survivorship. So the NCI estimates that 16.9 million cancer survivors were in the United States as of January of 2019. And by the year 2030, we can anticipate that there will be roughly 22.2 million cancer survivors in the United States. So when comparing new cases versus mortality, we find that there's been a decline since the 1990s. And so this is wonderful news. This is great news. This is news that tells us that our advances in treatment as it relates to cancer, our advancements in diagnosis and detection methods is working, and it's doing what it's supposed to do because we have so many individuals living with cancer in the United States. It is estimated that 67% of survivors are living more than 5 years after their diagnosis. And so that's wonderful news. That's exciting news. That's things that we like to hear because that tells us that the advances are working and we're detecting cancer sooner and individuals are able to live a full life after a cancer diagnosis. Years ago, when someone received the cancer diagnosis or they heard the big C, it used to be a scary time. It was a time of uncertainty and not really knowing where things were going. But because of the advances that have been made, that's no longer the case. So cancer is now considered to be in line with diabetes or hypertension. And so it's considered to be a chronic disease. So it doesn't carry that weight that it carried once upon a time just because we've made so many advances. And so those are good things. Now, when we look at those numbers, typically we hear the phrase, what goes up must come down. But when we look at the advances that have been made in regards to cancer, we're really going with a what goes down must come up. And so what that means is as the number of cancer deaths are decreasing, we've had a decrease in about 27% from 1999 to 2019. So that says individuals are living longer. So that means that we've got more cancer survivors in our community that we've got to take care of. And so how do we go about providing care? Back in 2007, there was a study that was done by the Institution of Medicine. And so the Institute of Medicine did a study that met with survivors, spoke with survivors to figure out what is it that you need from us and how can we help you enhance your health and wellness and lead a life that's full of healthy things going forward. So I love this study from the Institute of Medicine because it provides us with so much information about what the specific needs are of our survivors. And so this is one of my favorite quotes from this study. It says that the challenge in overcoming cancer is not only to find therapies that will prevent or arrest the disease quickly, but also to map the middle ground of survivorship and minimize its medical and social hazards. And so that was a challenge to us as providers, a call for us as individuals who work in healthcare institutions to figure out how we can minimize the medical and social hazards for our patients. And so this came from the research study From Cancer Patient to Cancer Survivor, Lost in Transition. And so what we found out from this research that was done by the Institute of Medicine is sometimes survivors get to a place where they're really not sure where to turn or what the next steps are. And so that's when cancer survivorship comes into play. A couple of years following that research study, the Institute of Medicine did another study. And this one was called Cancer Care for the Whole Patient. And so I love the way that's phrased, cancer care for the whole patient, because there was a point in time where our focus was, we're going to take your cancer out, we're going to treat your cancer with whether it's surgery or chemotherapy or radiation. And that was just focusing on one aspect of things. But as we learn more, as we hear from our survivors, we learn that there needs to be care for the whole person. That's the mental, the physical, the emotional, the social, the sexual, all those different things, the financial. There's so many different aspects to caring for a whole person. And so we felt that it was important for us to understand how we can care for our cancer survivors from head to toe. And my favorite quote from this research study says, good quality health care must attend to patients' psychosocial problems and provide services to enable them to better manage their illnesses and underlying health. To ignore these factors while pouring billions of dollars into new technologies is like spending all one's money on the latest model car and then not having any money left to buy gas to make it run. And so this says a lot. This says to us that what are we doing and what can we do to make sure that in addition to the advances in mammography machines and the advances in blood tests and different things of that nature, what type of programs can we provide? And so here at Gibbs Cancer Center, we are very fortunate to have a program dedicated to survivors and dedicated to doing things that we can do to help you enhance your health and wellness, but also provide programs that help us do that. When we talk about the whole patient approach, we really need to break things out into 4 different categories. And as you'll see on this slide, the quality of life model that's applied to cancer survivors, this is the model that we use here at Gibbs. This model allows us to look at your physical well-being, your psychological well-being, your social well-being, but also your spiritual well-being. And in order for us to truly provide care that's focused on cancer survivorship, care that captures making sure that we can provide you with an enhanced quality of life, it's important for us to look at the physical, the psychological, the social, and the spiritual. So when we look at the physical well-being of things, we look at things like strength, fatigue, sleep, rest, things that physically affect you, how you feel within your body. And that can include things as well as pain as well. When you come into our office, most of the time we ask you, how's your pain on a scale of 0 to 10? How's your fatigue on a scale of 0 to 10? And those questions allow us to assess your physical well-being. And we also assess your physical well-being based on the information that you provide us with how you're feeling as well. But when we dive into physical well-being, we find that there are 2 different areas that we look at from the survivorship perspective. Because here at Gibbs, when you come and see us in our survivorship clinic setting, you have completed your treatment and we're looking at things going forward. And so in going forward, we acknowledge and recognize that there are 2 different sections of your physical well-being that we have to discuss. So there are long-term side effects of treatment, but there are also late side effects of treatment. And so let's dive into both of these. With your long-term side effects of treatment, this is a problem that may be caused by the treatment of your disease and may come months or even years after your diagnosis. So long-term side effects of cancer treatment include heart, lung, kidney, or gastrointestinal tract problems. And so that could be things such as pain, numbness and tingling, loss of feeling, heat or cold sensitivity in your hands or your feet. That could be fatigue. That can be hearing loss, cataracts, dry eyes, or dry mouth. Those are some of the long-term side effects of treatment. And then we have late side effects of treatment. So with late side effects of treatment, this is typically a health problem that occurs months or years after your disease is diagnosed or after treatment has ended. And so with the late side effects, that may come from the diagnosis as well as the treatment as well. And so this includes your physical, your mental, and your social problems, as well as identifying second cancers. So from the survivorship perspective, let's look at your survivorship and your physical well-being. As I mentioned before, our focus is enhancing your quality of life. And so properly managing both those late and long-term side effects of treatment can have a positive impact on your quality of life. And we want to do everything that we can to make sure that we're helping you do that in our survivorship clinic. And so our recommendations may include monitoring your lab work. Your lab work often tells a story, and it allows us to get a better understanding of things and figure out, do we need to change this or do we need to change that? We can also make referrals to physical, occupational, and pelvic floor therapy. We are blessed and fortunate here at Gibbs to have an oncology rehab department, a department that's dedicated to providing physical, occupational, and pelvic floor therapy for our cancer patients. And so that's one of the things, if you come to see us in our survivorship clinic, if we identify that there are any deficits or there's anything that you may need help with, if you aren't able to button your shirt that you were able to button prior to diagnosis, or if you aren't able to scratch your back the way you once were, those are the types of things that we can send you to our oncology rehab department, and they can help take care of that. In addition to providing oncology rehabilitation, we also have lymphedema specialists here. And so all this is a part of your physical well-being. If you don't feel well in your body, oftentimes that impacts other areas. And so we want to make sure that we're doing everything we can to answer any questions or address any needs or concerns that you may have. And so seeing a lymphedema specialist may be one of those things. A lymphedema specialist is going to be someone who can help you manage any swelling that you may be experiencing secondary to your surgical intervention. We also have 2 dedicated registered dietitians that have oncology specific training and who are here to help our cancer patients with any of their dietary concerns as well. And so all these things are a part of your physical well-being, and we have different services and programs available to help address those different things. So, in addition to our physical well-being, let's look at our psychological well-being. And so psychological can be depression. It can include anxiety, fear of recurrence, and survivor guilt, as well as stress and emotional insecurity. A lot of these things not only have to do with you as the survivor, but they may include your family members as well. Oftentimes it's said that the cancer diagnosis isn't just for the survivor, but that diagnosis impacts your entire family. Depression and anxiety can come from you not maybe being able to do the things that you used to do. And fear of recurrence may be, is this cancer going to come back? There's also survivor guilt and stress, as I mentioned. And so ensuring that we do different things to help you combat this is what our job is in survivorship. We want to properly manage your psychological well-being because this, just like your physical well-being, it contributes to your quality of life. And we want to make sure that we enhance that quality of life. And so we may encourage you to use mind-body skills. We have meditation and guided imagery that may include some breath work and some movement and some self-expression. We may also refer you to a licensed counselor or refer you to a support group. So we are very fortunate to be able to be connected to some different counselors in our community and within our hospital system. We have a counselor that is dedicated to helping our cancer survivors embedded into our palliative care clinic. But we also have some individuals in Spartanburg and Greer and the Greenville area that we've connected with from the survivorship side of things to make sure that we can provide you that care that you may need. Sometimes it's a matter of identifying any coping skills or coping mechanisms that you may need to apply to life going forward. Oftentimes, survivors arrive at a new normal once they've completed their treatment. And so by addressing any psychological concerns, we want to make sure that we're helping you achieve new normal, identify what new normal looks like for you and your family, and help you move forward in a way that's going to be productive and healthy. Then there's also the social aspect. There's social well-being as well. And sometimes we forget about this portion, but we think it's important as well when we look at your survivorship. And so this can be your family and personal relationships. It can be a romantic relationship. It can be a work relationship. And it can also be your relationships that you've made that are embedded into the community. So how do we address things from the social side? From the social side, things may include your career counseling. Maybe your cancer diagnosis has changed things in such a way that the job that you once did, maybe that doesn't work for you physically. And so we have resources in the community that we can connect you to help you identify if you need to make a change in your career. There's also financial counseling. We are fortunate to have some wonderful social workers that are a part of the team here at Gibbs Cancer Center. And so we can give you some perspective on financial counseling. As we mentioned before, it could be individual counseling. Maybe some things psychologically are just a little bit off or a little bit different, and then it's impacting things in your social world. And we can address those things. We can make referrals to those different resources. There's also relationship and family counseling, and we also have the ability to refer you to one of our oncology social workers to do a consultation as well. And then there's the spiritual aspect. Again, as I mentioned, we want to make sure that we treat the whole person, the whole patient. And so that looks at the spiritual aspect of things as well. And so this can be your connections. This could be redefining your purpose, identifying how to achieve your peace, but also identifying areas that you want to seek some clarity in as well. So when we look at your spiritual well-being and how we can impact that, we may provide recommendations for you to meet with one of our chaplains, also a spiritual counselor, a spiritual support group. This may include meditation and mindfulness as well. But now that we've looked at these 4 pillars, these 4 areas of enhancing your quality of life, let's dive into some specific survivorship guidelines as well. So the National Comprehensive Cancer Network, or what we know as the NCCN, they have guidelines for you all as cancer survivors or for your family members or friends that may be a cancer survivor. And so we have guidelines as providers from the NCCN, but there's also guidelines for you all as patients. And the important thing about that is to say that, yes, as providers, we can provide you with information and certain things, but there are certain things that you can do to enhance your personal health and wellness and to empower you to do some things as well. And so these guidelines are specific to you as a survivor. Treatment is behind me. I'm looking at things going forward. I'm looking at my new normal. What guidelines do I need to follow to enhance my personal health and wellness? And so when we look at those things, when we start to identify this whole person approach, we've got to look at your health behaviors. And so by looking at those health behaviors, that may also include some lifestyle modification. And so let's talk about these things. Lifestyle modification may include stopping tobacco use. It may look at changing things in regards to alcohol consumption. We look at your nutrition, your physical activity, your weight management, your stress management, but also sun safety as well, because all these areas go into and dive into treating the whole person. So let's look at some lifestyle modification benefits. By making some changes in your lifestyle, we can decrease your risk of cancer recurrence. We can also decrease your risk of development of a new cancer, and we can also decrease your risk of other chronic diseases, as I mentioned earlier, diabetes, hypertension, things like that. And then also by making some lifestyle modifications, we can improve your overall health and wellness. And again, from the survivorship perspective, that's what our goal is. What can we do to improve and enhance your overall health and wellness? So let's look at a couple of these areas that we can work on a daily basis. So when we look at alcohol, there are some recommendations for cancer survivors in regards to alcohol consumption. And so that includes drinking in moderation. And so if you are a female, the recommendation is for you to have 1 drink or less in a day, in 24 hours. And for a male, that would be 2 drinks or less in a day or 24 hours. So what does 1 drink look like? So that, if you'll see on the right side of the slide, That looks different based on what type of beverage it is. So when you're looking at one drink in regards to a beer, that would be 12 fluid ounces. If you're looking at one drink from the malt liquor perspective, that would be 8 to 9 fluid ounces. In regards to wine, that would be 5 fluid ounces. And in regards to 90 proof spirits or hard liquor, that would be 1.5 fluid ounces. So this was a little trick in case you didn't know. Those etched out lines that is going to be on your solo cup, those things help us identify those number of ounces. So that very first line at the bottom on a solo cup is going to tell you how much a shot is. Going up to that next line, that's going to represent 5 ounces for your glass of wine. Then you're going to go into that 8 to 9 ounces for your malt liquor. And then the next line is going to be your 12 ounces for a beer. And so making sure that you follow these recommendations is going to be important, because research studies have shown that alcohol consumption has a direct impact on cancer development, but also cancer recurrence. So it's important for you to follow these recommendations. Now let's look at the nutrition recommendations. We base our recommendations from the survivorship perspective from the American Institute of Cancer Research. And so let's look at what these recommendations are. On this handout, you will see this beautiful, colorful plate at the top. And so this plate has some grilled veggies, it's got some quinoa, it's got some fresh veggies, some steamed veggies, and it's also got some chicken. Now, the recommendations from the American Institute of Cancer Research are that when you fix your plate, we want you to think of your plate like a peace sign. And so that small triangular portion of the peace sign at the bottom, that would be your lean animal protein or your protein. And so we want you to consume 1/3 or less animal protein and 2/3 or more fruits, vegetables, whole grains, and beans. So that 2/3, 1/3 ratio is really what we want to go for. Typically here, especially in the South, we don't always hit the mark on the 2/3, 1/3 ratio, but it's important for you to work towards achieving this ratio on a regular and consistent basis. And so it may be a gradual change, but there are definitely some goals that you can set to help you transition into achieving this new American plate. And so we can set goals in regards to fruits and vegetables. We can set goals in regards to whole grain, dairy and meat, high calorie foods and beverages, beans and legumes, but also your physical activity. So I think this is very, very important to keep in mind that when you fix your plate, let's go for 2/3 fruits, vegetables, whole grains, or beans, and 1/3 or less lean animal protein. And so again, you may not accomplish this overnight, but I definitely want you to work towards that. And while you may not hit this 7 days a week, if you can achieve your plate looking like this 5 days a week, then we're doing a great job. Now, to accompany those recommendations, you will see our shopping guide from the American Institute of Cancer Research. And so I love this. I think this is great for you. And feel free while I'm talking about this to take a picture with your cell phone. So the next time you go into the grocery store, you can have this list with you. From this list, you'll see fruits, vegetables. Those make up a long list of options that we have. We've got some great whole grain options, some dairy options, some animal protein options, vegetable options, small bites, and also condiments. And so again, the focus here is we want to achieve that 2/3, 1/3 ratio. Now, you see how beautifully colored this plate is. This is another important aspect. Research has shown that a variety of fruits, vegetables, whole grains, and beans opens us up to lots of health benefits. So our fruits, vegetables, whole grains, and beans have phytochemicals in them. And so phytochemicals help us combat disease, but they also do some wonderful things for our body. They're great for our vision and for our immune response and our hair and our skin and our nails. So there are tons of benefits that we get when we eat all these things on this new American plate. So I encourage you to eat a variety of those things. A lot of times we're creatures of habit and we eat the same apple, orange, banana. And while we may get benefits from those things, we may be missing out on some other benefits if we would eat some other things. We have a weight loss support group for our cancer survivors that we host virtually, and we meet twice a month. And one thing that we talk about when we meet is what's in season this month. And so by shopping by what produce is in season, that's going to be a great way for you to get some variety in. So cherries are in season right now. And most of the times the things that are in season are on sale. And so as you increase your cherry intake and increase your lettuce and your fruits and vegetables and all those different things, you're going to open yourself up to a host of benefits. So we've talked about some other things. Let's look at the physical activity side of things. So in regards to physical activity, this may be different for each individual. This has to be based on where you are. If you're just finishing your treatment, you may not be ready to dive into this just yet, but in time, you'll be able to get here. And so as I mentioned before, the National Comprehensive Cancer Network provides recommendations for us as providers, but also for you all as patients. And so when we look at physical activity, you will see here that the recommendation is for you to have at least, so that's at minimum, 150 minutes to 300 minutes of physical activity. And so that's going to be moderate intensity activity, or to achieve 75 minutes of vigorous activity. Now, in addition to your cardiovascular activity, which is what we're all so familiar with, it's important that we also participate in strength or resistance training as well, including the different muscle groups. And the reason that this is important is as we age, we lose muscle mass, but engaging in strength or resistance training allows us and helps us to be able to strengthen our bones, which in turn will also allow us to strengthen lots of other things. And so having a good core is important. And so strengthening our bones is going to help us long term. And so we want to make sure that we engage in routine strength and resistance training to exercise those major muscle groups. And keep in mind, you may say, well, I engage in physical activity. I walk my dog every day. So what happens is because you walk your dog every day, your body registers that as your normal activity. So to engage in physical activity, you're going to have to push it a little bit further and go beyond the things that you typically do every day. But I definitely want you, if you're not currently engaging in physical activity, to start a program to where you can work towards achieving 150 minutes at least of the cardiovascular activity, which is of a moderate intensity, or 75 minutes of that vigorous activity. So let's look at something and kind of bring things in and close things out. The American College of Lifestyle Medicine does a great job of capturing all the things that we discuss in regards to cancer survivorship and bringing it in. And as I mentioned, we want to do things and provide you with information that's going to empower you in things that you can take control of. You can take control of your nutrition and your physical activity, but there are also some other areas that you can take control of as well. So we talked about phytochemicals and different things like that in regards to nutrition, but the American College of Lifestyle Medicine also encourages us to eat those phytochemicals. But it also says, let's eat fewer of those foods that cause inflammation. And the reason why this is so important is because inflammation has been directly linked to cancer. And certain things that cause inflammation are basically our junk food, the fried foods, the meats and different things of that nature, things that are highly processed. So we want to work on eating fewer of those things. Eating the right amount of fiber is also very, very important. From the American Institute of Cancer Research, we encourage you to achieve at least 30 grams of fiber a day. Lifestyle medicine encourages 40 to 45. What I will say is if you are not hitting your fiber mark, I want you to take it slow because we don't want you running to the bathroom all day. So we've got to take that little by little. But achieving at least 30 grams of fiber a day is going to be so, so important. Another important aspect is your sleep. Oftentimes we neglect our sleep and we don't get enough sleep, but sleep is your ability to recharge your batteries. And so ensuring that you have 7 to 9 hours of sleep a day is going to be very, very important. Limiting your screen time often impacts that as well. So I encourage you to think of things that can help you achieve a healthy sleep pattern. And so that may mean stop looking at that cell phone prior to going to bed, because that can impact how well you rest as well. And again, hear from the College of Lifestyle Medicine talking about achieving that 150 minutes of moderate intensity physical activity. Last 3 areas that lifestyle medicine covers is avoiding risky substances. We mentioned that. That's your tobacco and your alcohol. We want you to consume no tobacco at all, and we also want you to only consume 1 drink for women a day or 2 drinks per men per day. This also looks at social connectedness. We talked about that before as well, and that's being engaging with places, people, and engaging in groups that are going to be strong for you and positive, and that are going to help you feel like more of yourself and feel like a better person. And stress management is another important aspect that's very important as well. And so coping with stress and managing that stress is going to be important. And so again, we've got resources available to help you manage those different things. And one of the last things we're going to talk about is your skin health as well, and sun exposure. Making sure that when you go out into the sun that you're wearing a hat, that you're also making sure that you use broad spectrum sunscreen. And so broad spectrum sunscreen has protection against UVA rays, but also UVB rays. And we want to make sure that we're doing a minimum of 30 SPF. And so including that in your facial cream that you use and your lip balm, also putting sunscreen on those arms. While you may work in an office all day, when you're in the car sitting in traffic, maybe on 85, you may expose your arms to a lot of sunlight. And so putting sunscreen on your arms. It's important to make sure that you apply that sunscreen generously, and also making sure that you wear your hat and you wear your sunglasses, and making sure that you're using it when you're in water sports and things of that nature. So taking care of your skin is also an important aspect of cancer survivorship as well. So we've talked about a number of different things, but at the end of the day, all these different areas come together to focus on caring for you as a whole person. We don't want to just take care of the physical and neglect the other areas. We want to take care of everything collectively. And so I hope I've provided you with some helpful information today, and I'm going to turn it back over to Lindsay, and if anyone has any questions.
Thank you so much, Stacey. That was wonderful. I know I learned a lot, and I'm sure everybody on here appreciates the feedback and all the recommendations you gave them. I do have a few questions I'd like to go over. The first question I have, it talks about your different programs. So could you explain what kind of classes, cancer survivor classes or programs you offer at Gibbs?
Sure. So we do a couple of different things. Now, secondary to COVID-19, we have had to change things a little bit, but virtually we offer a weight loss support group that I mentioned that we meet twice a week for that. And that's open to our cancer survivors, and I'm glad to have anyone join us if they're interested. In addition to that, we are offering a plant-based nutrition and cooking class virtually for our cancer survivors as well. And that will take place in the month of September. And we typically offer that class 2 to 3 times a year. We also have a support group for patients that we just finished, and we'll offer another. And that support group focuses on that psychological well-being. And so that's led by Dr. Elizabeth Willingham, who we work with. And we're focusing on things to enhance that mental wellness and providing support for survivors as well. So we typically try to provide things for the mental, the physical, the emotional, and the social. And so those programs are what we're currently offering. But if anyone is interested in getting on our mailing list, we do have an email list. I'm glad to sign you up on our email list so you'll know about our other programs that we have coming up soon.
Wonderful. Someone did ask if they weren't a part of their cancer treatment at Gibbs, but they'd like to be a part of the cancer survivorship program and y'all's cancer survivorship clinic. Are they able to participate, and how so?
So sure. So our programs are open to cancer survivors. If you're interested, you are welcome to give me a call at 864-530-6477. That way I can discuss your specific situation and figure out how we can best transition you into things. If you would like a visit in our survivorship clinic, that does require a referral, and we can talk about that. But feel free to give me a call. I'm glad to add you to our email list and also get you signed up for any of the programs or services that we have available.
Wonderful. Another question says that they've heard there's a new test kitchen at in the Gibbs Cancer Center new building. What kinds of things go on in there?
So we do have a demo kitchen here at Gibbs, and we love our demo kitchen. So in that demo kitchen, we have hosted some different classes. One was hosted called Cooking Up Confidence, and so it's where individuals were able to get a food box, and we were able to do our demonstrations. Again, secondary to COVID-19, we've had to do a lot of things virtually, but we are looking forward to being able to host our plant-based nutrition and cooking classes that I mentioned in person in our demo kitchen. And also, we are looking to add some things from the lifestyle medicine perspective and doing those things in that demo kitchen. And typically, when we are able to meet in person for our weight loss support group, we do some food sampling and some cooking and some food tasting in that class as well. So there are a number of different things that will be taking place in the demo kitchen. We've done some things virtually, but be on the lookout for some more things that we can offer in the future.
Wonderful. And speaking of food, I know you talked about trying to get at least 30 grams of fiber in per day. What about protein? How many grams of protein should cancer survivors get in per day as well?
So that's another question that we kind of break out on an individual basis. And again, I left my phone number for you all, and you're welcome to send me an email. I can be reached via email at swilliams@gibbscc.org. We typically base your protein needs on your current weight, but also your height. And so we have to break that out specifically because we don't want you taking in too much or too little. But I can provide you that information one-on-one if anyone is interested. We can talk about your specific needs and make sure that you're following in line with your protein. For anyone that's completely plant-based, I know sometimes there's a concern or worry about protein, but there are wonderful ways for you to get in all the protein that you need from just plants as well. So keep that in mind. Don't be discouraged if you're looking at that 2/3, 1/3 ratio and thinking, oh, am I going to get enough protein? There are definitely some great ways that we can make sure that you get all the protein you need from plants.
Okay, great. Thank you. And it looks like our last question has to do with sun safety that you mentioned towards the end of your presentation.
Yes.
They asked, is there a specific brand type of sunscreen that you recommend?
So no, there isn't a specific brand. These are just the high points. Definitely needs to be at least 30 SPF. And also we want to make sure that it's UVA and UVB. So making sure that it's that broad spectrum. What I will say about sunscreen is I really want you to find a brand that's comfortable for you. Sometimes we may spray on a brand or use the cream of a brand and it makes us feel a little sticky or it makes us feel a little icky. And so that discourages us from using it consistently. But I definitely want you to find one that you like, that feels comfortable to you, and that you can use on a consistent basis. And my family, we personally like to use the ones that are in the can, that are the liquid and that are a light mist. because it's easy for us to rub in. But the main things are at least 30 SPF and make sure that it's broad spectrum. And so maybe start off by buying just a little size of the different brands that you're interested in, just to make sure it's comfortable for you. In my house, we use Neutrogena for my husband and I, but for our son, we use Aveeno. So it's just a matter of making sure that it's 30 SPF and that it's broad spectrum. But I would say if you're in the market for a new sunscreen, start off small to make sure that it feels comfortable to you on your skin, but also with your clothing as well.
Okay, wonderful. That's super helpful, especially as we're in August and people might be going on vacation if they haven't already. So I really appreciate that. That's all the questions we have today for you. I just wanted to thank you again for taking the time to talk to us today about cancer survivorship. I know there's a lot of classes and programs to get involved in if these people are not already, and if they have any questions, to get in contact with you. And I just want to thank you again and thank everybody for being here. Have a wonderful day.